Every healthcare organization says that they want to change patient behavior. But if that's really the case, then why are we still just bombarding people with more emails and more texts filled with facts that we've already told them or that they already know? The reality is, giving people more information isn't the same as giving them a nudge. Now, I know some of you will say, hey, won't AI fix this? But in reality, we're kind of sprinkling AI on everything, expecting it to magically fix it. But spoiler alert here, in this particular instance, people are irrational, but AI is wholly logical. So AI alone isn't going to solve this healthcare behavior puzzle. It's going to take something called behavioral economics. And I'm excited to dive into that topic with Karen Sussman Horgan. She's the CEO and co-founder of VAL Health. And together, we're going to unpack how boutique behavioral science is helping large health systems and payers double screening rates by playing on the fact that people are a little bit lazy and a little bit irrational. From the future to present trick that is doubling smoking cessation to a simple menu hack that's cut calories by 25%, you're going to love how we're uncovering the hidden drivers of health. Let's get to it.
Swaay Health. Well, Karen, welcome to the program.
Thank you for having me. Honored to be here.
I'm excited to dive into this topic with you. This is a topic that fascinates me. The area that you work in fascinates me. But for the benefit of our audience, Karen, can you introduce yourself and tell us a little bit about VAL Health?
Happy to do that. So I'm Karen Sussman Horgan. I'm co-founder and CEO of VAL Health. We are a boutique consulting agency that takes behavioral science and creates nudges in healthcare. So I'll take a step back because I realize I'm defining what we do with the same words. So behavioral science is the art of understanding that we as humans are irrational. We have biases to the present, we have aversion to loss and regret, we overweight probabilities. And what we do at VAL Health is we harness those irrationalities. We don't ask people to change them. We recognize that that's how people are going to behave. And we work on nudges across the healthcare ecosystem that might be optimizing journeys or changing language and all of that. And I know we're going to dive into a lot of the specifics there.
Yeah, I mean, it's fascinating to me because what I know of behavioral economics, it comes from being a fan of Freakonomics Radio and NPR, which of course is leaning into, well, the way I describe it is leaning into human behavior in order to drive activity, and usually activity is buy more or do more. Right. But in this health context, that's not actually the end goal. The end goal is not to consume more or buy more healthcare. It's something else. So how would you describe how behavioral economics applies to healthcare? You mentioned a couple of things, but how would you describe it to someone who really isn't that familiar with behavioral economics?
Well, I'm really glad you brought that up, that behavioral economics is usually used to nudge people to buy more. It's, people like you have done this. Oh, I need to go buy that sweat. Or I'm at a casino and they use streaks and the like to get people to do more. When we think about behavioral economics, and I use the term behavioral economics and behavioral science interchangeably, when we think about it, we use it to nudge people in healthcare to do things they know they should be doing, but have a hard time doing. So we oftentimes work on getting people in for preventative screenings. It might be mammograms, colonoscopies. We worked with Sutter Health and we got 2.4 times as many women in for their pap smears. And what we did is we used email and we incorporated social proof and localization instead of just giving people information. And that drove big impact. With another payer, we got a 30% increase in people living with diabetes going in for their diabetic retinal eye exams. And again, we brought in behavioral science, the concept of endowment and exclusivity to nudge people to go do that. And so we incorporate that into the user experience, and it might be in digital health. It might be from an insurance company, it might be through a hospital system or even pharma.
Wow. Okay. So you're nudging people to do something they should be doing. Like you talked about preventative, but I'm also assuming it's also healthier behaviors in general. Is that something you've worked with people as well?
Yeah, we've done a lot of work in tobacco cessation, in weight loss, and weight loss incorporates everything from uh, portion size to the food you're eating to exercise to managing other conditions. And we oftentimes bring in solutions like streaks, social norms. No one likes to miss out on something that they have. If you've ever played games, you have a streak and you don't want to do that. In terms of learning languages, Duolingo is really good at getting people to come back every day because you don't want to lose that streak. And so we can bring that in, particularly on if it's logging or you've done this for X weeks in a row, you don't want to miss out.
Well, I'm interested in the dive into that portion of it, but I have to
Yeah.
ask this, like in healthcare, it's a little bit odd because unlike the consumer world, you're motivating to someone to do something that may not be in their absolute best interest. You're encouraging them to maybe spend money on something they maybe don't need. But in healthcare, most of the time, what you need is good for you. Like it's going to extend your lifespan. It's going to reduce your costs. So you would think that that is motivating enough. Like adding 10 years to your life, adding 5 years to your life would seem pretty motivating. Why is that not enough?
I'm glad you brought this. You're getting to the heart of what behavioral science is. Behavioral science recognizes that as a human, you're irrational. And so it's hard for me to anticipate the future. And so just what the healthcare system is really good at is just giving you facts. The US Preventative Task Force says X. You should be doing this. You're this age. You should be getting that. But it's so easy to push that off to the future. It's the invisible that I don't feel my blood pressure. I don't feel my kidneys are hurting. I don't see that I've got cancer. And so it's how do we think bringing the future to the present, how to create this sense of accomplishment, how do we create the sense of others are doing this? And that's what motivates me. So we do play on that irrationality to nudge that engagement. And we do a lot of work, even think of GLP-1s. You would think that everyone wants to be adherent to their GLP-1, right? It's the magic drug. But oftentimes they stop taking it. There's side effects. How do I get through this? There's costs. I think I've got this under control now. I don't need meds anymore. And that is completely assuming you're really rational. But we truly are not rational. And in healthcare, the irrationality comes out because, to your point, if I know that doing this preventative screening is going to save me 10 years of my life, of course I should do it. I can give you an example if that's helpful.
For sure.
So
Please.
you've got someone who is a smoker, and this study's not done by our team, but I use it. You go in for a lung capacity test, and then numbers are given. The results are in a numerical format that means something to the clinician, but not you as the patient. About 6% of people quit smoking a year later. Fabulous, 6% quit smoking. If instead you're given the results in a common language of you are a 32-year-old male with the lungs of a 50-year-old, double the number quit smoking because you've brought the future to the present. You've got I'm 32, I don't want to be 50. And that is something people can internalize that gets them to take action.
Interesting. So just by changing how the result is presented, contextualizing it in the present, as you put it, motivates almost double the amount of people to quit smoking.
Yes.
Wow.
So we play on that irrationality. We still use facts and information, but we've repositioned that.
Okay. All right. I'm starting to get a picture here. So
Here's another example of how we as humans are lazy, like we really are. So there's a couple things that, one of our studies done by our team members trying to get people to purchase fewer calories. And you could put calorie labeling, and that basically had, no difference in the number people purchased. Instead, if you list low calorie items first on a menu versus high calorie items first on a menu, this was in a sandwich shop, people purchase 25% fewer calories when low calorie items are listed first. We truly are lazy. There's nothing wrong with that, but how can we use that to our advantage to nudge healthier behaviors?
Gotcha. Gotcha. So again, just by listing these things first, not by changing anything in terms of the content, flavor, anything like that, just by listing it, you're encouraging a healthier behavior.
Yep. And we're not taking choice away. We are
Right.
just nudging you and playing on the fact that you're lazy.
Karen, I want to go something more specific. You mentioned off the top, no shows. I mean, that is a huge problem for a lot of practices. I'm sure a lot of practices are listening who are maybe going through some of these no-shows. I mean, with AI now, we have this capability to maybe personalize the messages, and that is, we're seeing a rise in how more effective, much more effective that is. But it doesn't incorporate behavioral economics into that. It's just rewording things. Can you give me an example of how you've helped someone through that no-show?
Very much so. And I'll start by addressing what AI often does is it increases the frequency of when you're going to get a message. Like just before this, I got a message, your primary care doctor is next week. So they're using facts and information. And what they're going to do is they're going to what we call nudge the people who already would have done it. Like I'm already going to my PCP. It's great you've sent me a reminder. And so that is really useful. But what we need to do with AI in particular is bring behavioral science into that messaging. We need to bring in what we did with Mount Sinai Hospital in New York City. We had a 15% reduction in no-show. And that was by bringing in social proof. 9 out of 10 people show up for their appointments. And it was bringing in reciprocity with the clinician, that when you scheduled your appointment, you were looking at the doctor in the eye, and et cetera. And this was for a Medicaid population. So very high no-show rates in that population. And so as we think about AI, which is where you were going with this, it needs to bring behavioral science into that framing. Otherwise, all we're doing is giving more information and bombarding people even more. And we're not nudging. They're actually going to get so annoyed that they're probably just going to wait, stop. And then you've eliminated the entire touch point on the ability to reach them.
Gotcha. So again, like something as simple as the doctor looking that person in the eye when they were booking the meeting or
Yeah.
the next appointment, not meeting, the next
Yeah.
appointment. And just something as simple as that leads to a higher show rate.
That combined with, we had that combined with social proof of 9 out of 10 people show up, and that reduced 15% reduction in no-shows.
Incredible.
Well,
And you bring up a good point here about AI. You're saying that right now the AI tools just increase frequency and maybe increase the likelihood of it being in the right language for me, which does help. But as you're saying, it just nudges the people who are already probably leaning that way anyway.
Yeah. Yes. And then we oftentimes think about how do you, we don't want to bombard, and we want to make sure we can keep using that touch point. And so we can learn a lot through this.
Interesting. I mean, I'm just fascinated by it. This is so fun. This is so much fun.
It was a fun job I have.
So how does one get to you? Like, what are the signs, Karen, that I might need the help of someone who's familiar with behavior economics versus just adding more technology, like a better reminder system or a better this or a better website to help make it a little bit easier to book an appointment? Like, how do I know when it's like, hey, it's time to bring in an expert like you?
That is a great question. And so what we get to is when we work with clients, they've tried giving more information. They've tried we're going to give facts. Look, we have the right facts. We're getting to them. We got them that they now say we can use SMS. We've got all these touch points. But what they're missing out on is all you're doing now is, I want to use AI slop, because it might not be slop, but all you're doing is annoying them. Because now you're reaching them, you're giving IVR outbound, you're doing emails, you're doing SMS. What you're not doing is getting to the innate biases that they have within them that gets them to say, oh yeah, I'm going to go do that. And so when clients come to us, it's that either they're innovative, which we love because they want to try new things. And they're like, we keep trying to give people the facts and we're not getting any engagement, or we've plateaued. So that's when we oftentimes get involved.
Gotcha. So if I could just paraphrase back, when you're at a plateau in terms of your results, when you've added technology and you're not seeing any difference, this might be time to relook at the underpinning, the actual behavior that you're trying to motivate, as opposed to, you've reached basically the limit of the technologies that you've been deploying.
Yes, and maybe you want to talk to us before you spend millions of dollars on deploying technology, because we might be able to get you somewhere without you having to spend 3 years and millions of dollars.
That's true. Going back to your example of the list of items on a menu, like just by changing that up, no difference in technology, nothing else, and you're already getting a 15% bump, right?
When we work with clients, it's usually we want to see an impact within 90 days of our solutions being created.
Within 90 days.
In 90 days. Because we work in guardrails of, okay, this is the tech we have, or these are the touch points we have. Let's make an impact now. This is not a 36-month. We can keep making an impact over 36 months, but let's get something out there now.
Wow. Okay.
Yeah.
All right. So Karen, like we've talked about how, how to notice the signs when it's time to kind of do this. You mentioned some of these results that you've seen. Like these are pretty significant, double-digit percentages in most cases that I've heard so far from you. Can you give me an example? Like what's been some of the most significant improvements that you've seen when someone has done this? Maybe not so much in terms of percentage, but in terms of impact, maybe on patients.
Yeah. So there's one that we can't quantify, but I'll give an example. We worked with one of the largest national payers in Medicare Advantage,
Okay.
and they wanted to improve seniors and member experience. Actually, I can give some numbers of how do you get seniors to take care of themselves? How do you have them to have a positive experience? Because we know healthcare, it's confusing, oftentimes it's annoying. We just don't want any of that. And we worked with them on their digital platform on nudging people to do what you might call the next best action, but we're calling it an action that may not be next best, but got people engaged.
Mm.
And so I bring that up because sometimes when you're designing a member experience, you need to focus on quick wins and what is actually going to mean something to someone. It might be update your email address and you get a prize. It might be here's someone, a dedicated navigator who can help you. And it doesn't mean you're necessarily getting straight to the I need you to go in for a colonoscopy today, but you're improving that member experience so that way when you get to the point where you're talking to them about a colonoscopy, they're listening and they've already felt like they've made progress. And what we found in this case is we got a 16% lift in people taking clinical action. And just by not necessarily going straight to that clinical action, but adding wins along the way. So that's a really powerful way to show that you can focus on experience. We've also done, and I mentioned earlier, even with Sutter Health, or actually there's a digital health weight management company, and they wanted to increase enrollment. And what we took approach in two ways. One was how do you improve the journey, and the second was how do you incorporate messaging. And improve the journey was eliminating steps.
Mm.
Someone's ready. You don't need to ask them 17 questions along the way. You don't need to put the landing page with 7 interstitials and like all that old school stuff. They're ready to go. Get them registered.
Mm.
And so a combination of reframing on scarcity, exclusivity, social proof, and eliminating friction, we got somewhere around a 3 times increase in enrollments completed. And again, that could be implemented rather in an expedited timeframe.
Now, Karen, we spent a lot of time talking about behavior change in patients and you
Yeah.
working with payers and providers. I also heard when we were talking offline that you work with technology companies, IT companies. Talk to me a little bit more about that kind of work. How do they incorporate what you work on?
So there's 2 ways that they can incorporate what we do. One is what we might call technology, or even if it's AI, adoption. Like we have this tool, it's getting rolled out. How do you actually get people to change their behavior? How do you get providers to actually start to use this? How do you get patients to incorporate this into their journey? It might be a remote monitoring blood pressure company. And how do you actually get them to check their blood pressure? And that's where we bring in a lot of that is on framing. And we think about launch, learn, and last for tech companies. Launch is get people in. Learn is that onboarding state. What are they helping them understand what they're supposed to do with you? And then the last phase is ongoing engagement because the frequency of which you need to interact oftentimes decreases over time, whether you are a provider, a patient, a consumer, or the like. And so we have different tools on how we incorporate defaults or framing on that journey. So that,
Interesting. So you're applying behavior economics to the rollout of the technology
that could
itself.
be
It
one.
sounds like, wow.
The second way would be within the technology and how we talked earlier today on how that technology is doing lots of communications and nudging it. And sometimes less is more. Sometimes fewer messages, time using the right framing is better than people getting bombarded. And so we do a lot of work on helping clients figure out the words to use in an SMS and how does that get coupled with an email campaign. Because an SMS, very tight, right? You get that. You know someone's going to look at it just because they do. An email, someone may never see. And so, not that we use clickbait and SMS, as I'm pointing to my phone, that we think about how do you get someone to feel like I need to respond to this, I need to take action, and how do you make it one click if it is to schedule appointments or to get help or to commit to doing something. Like there's commitment devices and different tools that can be used. Whereas if it's an email, we might provide more information in a behaviorally framed way. And the buttons are really important to have a strategic call to action. Get mine now, or I want the easy path. What is it other than just like click here?
Right. I mean, again, this is incredibly enlightening here because you're talking about, you mentioned off the top, like streaks and maintaining that, I mean, and incorporating that into some of these things. You could see how by doing that, you can motivate some pretty interesting behavior for a rollout, right? Like, hey, you spent 5 days in the application already. Let's make it a 6th. Like, don't break that streak, right? And keep logging in. And we know, and once you start logging in and incorporate it into your day to day, it soon becomes habit, right?
That is well said.
But creating that habit takes time, takes repeated action. And yeah, to be honest, it's not something I thought of when I was part of a vendor and was thinking about rollouts, but I can see now how that could be really powerful, right? To increase the likelihood that I'm going to be used and achieve all those lovely promises that I made to my customer, right? In terms of the benefits that they're going to get. Interesting. Karen, as you look across the healthcare industry right now, is there anywhere that you're like, boy, I wish they really would incorporate more behavior science in this area?
I don't want to sound like a cliche, but it's very much an AI. What we're seeing is everyone's saying, "Oh, we're launching AI," and in the same way years ago when they're like, "I need engagement," and we'd say, "Well, what does engagement mean to you?" And now we say, "What does AI mean to you?" And they're like, "Oh, AI is our fabulous way we're going to get engagement." And then we like start that conversation on, well, AI might be able to better segment your population, but you still need to frame to that population in a certain way. You still need to think about less is more. You need to think about what does that AI tool mean. So that's one area, and the other would be in the provider side, getting providers to, uh, particularly in the primary care, driving behavior change in providers. Primary care very difficult. So how do you make the right path, the easy path for them, and how do you incorporate social proof and the like to nudge them?
Now, Karen, I understand, well, at least from what I read and what I hear, that behavior economics, it can be very dangerous when misapplied, right? And
Yes.
like marketing, it can be misinterpreted a lot if you're not in this world and use it day to day. So, where would you recommend that healthcare leaders go to learn more about behavior economics in healthcare?
That's a great question. There is no magic source, but there's two I would recommend. One is CHIBE, CHIBE. That is the Center for Health Incentives and Behavioral Economics at the University of Pennsylvania. It is founded. My co-founders are involved with that, and they do, as it says, all about behavioral science, behavioral economics, and healthcare. Different experiments they run. They've got a great newsletter, so really great way for things to be pushed towards you as well as to learn. And if you're looking for a podcast, Katie Milkman has a great podcast called Choiceology. I don't know if you've seen that one. I mean, that's really useful. So that goes beyond the standard for economics and all of the others. But between Chibe and Choiceology, those are great ways to get started.
Excellent. And of course, Karen, how can people get in touch with
Yeah,
you? Where can they go to connect with
great
you and
question.
learn about what you do?
I am not as prolific on social media as I should be. So I would say LinkedIn, Karen Sussman Horgan, and then VAL Health. We have a monthly behavioral, we call it VAL monthly insights that come out. And then you can always reach out to me directly, khorgan@valhealth.com. And those are great ways to start following us.
Well, Karen, thank you so much for all this great information. I could dive into this topic for like a few hours with you, and
Oh, I
maybe
could
we
talk for
will.
hours.
Maybe we'll on a future date, but really appreciate everything you've shared with us today. Thank you for being on the program.
Thank you for having me. This was wonderful.
Wow, I loved that discussion with Karen. I was absolutely blown away by the results they achieved through simple changes informed by behavioral economics. The example of increasing smoking cessation by just telling people that they have the lungs of someone much older shows how appealing to our emotional, irrational brain can sometimes be the hack that we need to get people to move in the right direction, especially when it comes to our own health. I can't wait to have more discussions like this in the future. And hey, if you made it this far in the video, we would really appreciate it if you mash that like button and click subscribe. Also, head over to Swaay Health, that's Swaay with 2 A's, .health, where you can find more great content like this. I'm Colin Hung, thanks for watching, and I'll catch you on the next video.